Hello and welcome everyone to the Right Care Challenge and Enhancing Integrated Care live Q&A webinar. I'm Bill Callery, Senior Program Lead at Healthcare Excellence Canada, and I'm pleased to be one of your co-hosts today alongside my colleague Megan Sabian. Before we get started, I'm going to go through some of the technical components to ensure all of you joining us today from across the country have what you need for a positive online experience. Please note that this session is being recorded, and we're pleased to offer French simultaneous interpretation provided by Karen Rosbach Communications Incorporated for this session. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your screen. If you do not see the interpretation menu on your screen, please select the More menu button and select Interpretation. And we invite you to share your questions and comments at any point using our chat box in either English or French. And we encourage all of you to respond to comments and answer questions in the chat as you wish as we go along. If you need support at any time during this webinar, you can reach out to the participant named Tech Support Soutien Technique using the direct chat feature. So I'd like to start by acknowledging that we're meeting on land that has been inhabited by Indigenous peoples for millennia. And in particular, we acknowledge that we're broadcasting this webinar from Ottawa-Gatineau, where I live, which is the traditional and unceded territory of the Algonquin Nation. And Megan is joining from Kentville, Nova Scotia, the traditional territory of the Mi'kmaq Nation. And we want to recognize and deeply appreciate their historic connections to these places and the opportunity to gather here today. We also invite you to introduce yourself in the chat and let us know the lands you're joining from today. And thank you to our HEC colleagues in the background who are adding the native land website in the chat if you'd like to learn more about the territory you're joining from. So Megan and I will be your hosts for the next hour, and during today's discussion, you'll hear about HEC's pan-Canadian movement to improve care for more people, and how you can take part in our new offerings, the Right Care Challenge and Enhancing Integrated Care. Care Forward is a newly launched pan-Canadian movement to improve healthcare by sharing knowledge and applying proven approaches. With support from Healthcare Excellence Canada and partners, changemakers are driving local, lasting impacts and improving care for over 1 million people across Canada. Designed to be inclusive and flexible, Care Forward brings together teams from all types of organizations and those with different roles, capacities, and starting points. So whether you're just at the beginning or scaling an established innovation, there's a place for you. Our offerings are focusing on 4 key priorities: expanding access to care and easing pressure on emergency departments, helping more people age where they call home, advancing safe, person-centered, long-term care, and supporting the health workforce. Teams from across Canada can join our new offerings designed to meet their goals, needs, and capacities. And HEC, along with our 26 supporting organizations, are here to offer tools, funding, coaching, and a pan-Canadian network of peers. Did you know that 38% of Canadians say their last visit to the emergency department was for a condition that could have been treated elsewhere, or that nearly 1 in 5 adults in Canada don't have access to a primary care provider? Everyone in Canada deserves timely access to healthcare, including care closer to home and in their communities. And we know that when people can connect to the right care at the right time and in the right place, they're less likely to turn to emergency departments for issues that could be managed elsewhere. That's why our first priority under the Care Forward movement focuses on expanding access to care and easing pressure on emergency departments. This priority area is guided by 4 evidence-informed pathways, supporting community-based health promotion and disease prevention, expanding access to primary care, enhancing appropriate care through service integration, enabling role substitution, and health workforce improvements and changing advanced practice roles. So building on these pathways, HEC aims to accelerate innovative community-led solutions. And that's where the Right Care Challenge and Enhancing Integrated Care come in. These programs are designed to support teams committed to delivering timely, appropriate, and accessible care outside of hospital settings. I'll now turn it over to my colleague Megan, who will be going into more specifics on our first offering.
Great, thanks so much, Bill. So let's start with the Right Care Challenge, a light touch, flexible, outcomes-based innovation challenge that invites teams already working on or have an idea that they want to test for reducing avoidable emergency department visits, ensuring that patients receive the right care at the right time and in the right place. We're pleased to deliver this offering in partnership with the Graham Beck Foundation to offer a suite of monetary awards specifically for integrated youth services teams participating in the challenge. The Right Care Challenge is a 12-month offering that will provide resources and support in addition to monetary award opportunities to teams who are launching or enhancing solutions to expand access to care and reducing pressure on emergency departments, rewarding their success and sharing the learnings with others who could apply them too. We welcome health and social organizations at all stages of their quality improvement journey to join, including those that have recently identified a need, have conceptualized a solution, or have already initiated implementation. Registration into the challenge is done in a few simple steps, usually completed in under 5 minutes with the required information at hand. Once enrolled into the challenge, participation is flexible and low effort, where teams can avail themselves of monetary award opportunities and team supports that best fit their needs. Participants will have a chance to win prizes through various award submission opportunities, recognizing their work to expand care and reduce avoidable emergency department visits in 4 key areas. These include community health promotion, including initiatives that prevent diseases and promote health right where people live. Workforce transformation efforts, including those that expand scopes of practice, reduce administrative burden, and improve licensing pathways. Integrated and innovative models, such as virtual care and connected medicines, that better connect primary, urgent, and emergency care. And also expand primary care access through team-based models, optimized scheduling practices, and more. So registration into the challenge remains open until October 31st of 2025, with award opportunities starting as early as June. However, it is important to remember that the earlier you join, the earlier you can take advantage of award opportunities and program support, such as coaching and networking activities, curriculum, and access to virtual learning. Taking a more detailed look at the monetary award opportunities, participating teams will be invited to submit reports describing their work in several themed opportunities for a chance to win monetary prizes. There is over $900,000 in prizes available across more than 400 awards, whereby a single team could win as much as $34,250 if they are successful across all award opportunities. Our partnership with the Graham Beck Foundation also provides for specific prizes to support integrated youth services teams with 5 GBF awards of $10,000. There are 2 ways to earn monetary awards within the challenge: draws and merit-based awards. Draws are based on participation milestones, such as completing a registration into the challenge, or completing a team survey, or submitting reported data of your work. These opportunities allow teams to earn ballots into draws, where prizes range from $250 to $2,500. The merit-based awards are based on submissions and are scored by a panel of judges. These awards offer opportunity for teams to submit reports, such as innovation plans, plans for sustainability and long-term success, just as examples. These are also where the aforementioned awards for participating integrated youth services teams are included, provided in partnership with the Graham Beck Foundation. These prizes range from $500 to $10,000 depending on the specific award opportunity for these merit-based awards. Shifting now from monetary awards, the challenge also provides teams with program supports throughout the course of the 12-month offering. As you can see per the timeline on this screen, we will kick off in the month of July with hosting a joint orientation event with the Enhancing Integrated Care teams to welcome enrolled teams into the offering and kickstart your journeys to set you up for success. This timeline also points to other important dates to consider. As part of the opportunity for teams to measure and report on their work, which is tied to more than 100 awards, the first reporting deadline is August 28th, with subsequent reporting periods following on a quarterly basis throughout the challenge. And we will go into a little bit more detail on this in a bit. This is also going to be the date for the first merit award submission, the innovation plan. Award opportunities will continue through May of 2026, with program support opportunities taking us through to August 2026 with a final celebration event. To see the awards in more detail, please see the Right Care Challenge terms that can be accessed on our website or through the chat box. I'll now turn it over to Bill to look at our other program offering, Enhancing Integrated Care.
Thanks so much, Meg, for that great overview of the challenge offering. So for Enhancing Integrated Care, it's a 12-month program that will bring together about 100 primary and community care organizations to collaborate, share knowledge, and implement evidence-informed and team-based promising practices, including virtual care models that are improving access to primary care and reducing pressure on emergency departments. So you might be wondering what we mean by integrated care. Well, we're really referring to collaborative approaches where different healthcare providers work together as a team with patients and caregivers to provide coordinated, patient-centered care, ensuring patients receive the right care at the right time. So, for example, teams may include primary care providers, specialists, allied health professionals, community and social workers, pharmacists, mental health professionals, just to name a few. If you're working to improve team-based integrated care in primary and community care settings, such as clinics, hospitals, home care, mental health, or long-term care, then this offering is for you. By participating in Enhancing Integrated Care, your team could receive up to $10,000 in seed funding, as well as coaching sessions from experts, virtual learning and networking opportunities, and measurement and evaluation support. So here's an overview of the application and funding timeline. Applications to the program are open and will be accepted until June 19th. After that deadline, a panel made up of HEC staff is going to review the submissions. And once our final selections are made, teams who are accepted into the program will be notified by July 2nd. And if your team would be selected, we'd ask you to confirm your participation and sign the collaborative agreement by July 14th. As I said, each team would be eligible for up to $10,000 in funding. So, for example, the first 80% or $8,000 for teams receiving the full $10,000 would be issued upon receipt of your signed agreement in July. And the final 20% or $2,000 would be issued after you complete all of your program requirements and submit your final reporting. Now, we know this is a lot of information to take in, but please know our team is here to support you and to guide you through the entire process. So over to Meg for a few more details on both of these programs.
Great, thanks, Bill. So we're going to switch gears a little bit here and look at elements that tie into both of the offerings, given that we're integrating the two of them. So speaking of supports, we know that many questions stem from measurement and reporting data. So we would like to cover that before we get into the open Q&A. Both offerings involve the same reporting structures, and all teams will be asked to submit quarterly reports on REACH, and will select only one of the following measures. So that includes option A, a patient survey measure, option B, an ED usage measure, or option C, northern, rural, and remote option. For the Right Care Challenge only, the quarterly report submissions are connected to award opportunities. So each quarterly report will include different measurement and data points. All participating teams will be asked to provide project details, reach and progress, measure results, and their reach and outcomes. Later in each offering, you will also be asked to complete surveys that gather information related to team members and project sustainability once each offering comes to a close. These dates will differ between the challenge and the Enhancing Integrated Care. However, each participating team, I should say, in either offering will be required to submit reports within a similar timeline. Leading up to each reporting period, participating teams will be provided with guidance, instructions, and support on collecting and reporting their data. So Bill, I'm going to turn it over to you now to talk a bit more about the joint activities.
Thanks, Meg. So throughout both offerings, there are going to be opportunities for shared activities, including webinars, coaching sessions, and additional learning activities. So first, our small group coaching sessions will be offered every other month and take place virtually. The sessions will be facilitated by assigned members of our coaching network, and teams would be asked to come prepared for the discussion with their data, any updates and questions that they have. And individual coaching support is also available on demand. Additionally, teams are able to join several virtual learning activities that will be hosted by HEC in various quality and safety topics, such as lived experience of patients, caregivers, and communities, people in the workforce, value, culturally safe and equitable care, and First Nations, Inuit, and Métis priorities. Now, to give you a sense about what it's like working with HEC, we wanted to hear from one of our past program participants. So we're going to share a short testimonial from Lori Flores, who's a registered nurse from Island Health in British Columbia. Lori's team participated in 2 previous program offerings similar to these current program offerings. They were called the Health Workforce Innovation Challenge and the Partnering on Appropriate Virtual Care Collaborative. So I'll ask Carol to bring up the video now.
The amount of staff who said they've never worked in a place that they felt so supported. They enjoyed it. There was a sense of collaboration with the team. It just really changed the culture within our department. There was a lot of education. There was a lot of learning that went with that was being provided by HAP. It opened up resources that I was not familiar with at all. And so learning new ways of doing things, learning how to lay out the plan, learning how to use techniques that were already there that I wasn't familiar with, and being required to put the data and stuff into a story was really helpful, not just for our relationship with HEC, but also with our staff, because then we were able to go back to the staff and give that story in a logical format. I really found the group meetings beneficial to see what the other people were doing. And some of them, like, seeing little organizations or little people who were going, oh my God, this is so overwhelming. Where do I even begin? To hear someone else say that was really reassuring. And then to hear there were some pretty big ideas out there, and to see how they were working on them. And then you'd see them in another collab meeting or get together. And it was like seeing how it was being built upon. That was contagious. It was like, oh, we can think bigger here. We can really make a difference. We created change. And without having that challenge there, without having healthcare excellence behind all that, that wouldn't have happened. We just wouldn't have done this journey. Get senior leadership involvement. Once they understand what is being provided and they catch the vision for it, then you get more support. As soon as you have senior leadership behind it, it gives more authority to the team, gives them more ownership in it, and more buy-in. So I would really recommend you do your best to get senior leadership involved in whatever challenge is being brought forward, because they get tired too of not thinking that sustainable change is possible.
Huge thanks to Lori and the entire team who put together that video reflection. We really hope it gives you a little bit of a flavor of the experience of a past program participant, and also hopefully some of the tips that Lori shared will be useful to you as you consider these opportunities. So we now have an opportunity to hear from you and take any questions you may have over the next few minutes. We ask you to share your questions with us using the chat box, and we'll do our best to get to as many as possible. So watching the chat for any new questions that come in.
And Bill, maybe while folks are typing in their questions, I can pick up on a couple that were already addressed in the chat, but maybe helpful for other folks to know. So these, as Bill mentioned at the outset of this webinar, this session is recorded and will be shared with all registrants to the series. So that will include these slides as well, as I know that was of interest to folks. And another question that just came in with that great video from Lori was around accessing that possibly on YouTube. It is not available on YouTube. However, will be part of the recording for this session, of course, which will again be shared with participants in the coming days.
Thanks, Megan. Starting to see some questions coming in through the chat, so we'll get to those. One of the first questions coming in is, if we have an existing improvement project underway, are we eligible for these programs, or would we need to start something new? So I will start off by saying yes, for these programs, you can absolutely get started if you have an existing initiative underway. If you're thinking of starting something new, or you're just at the beginning, the Right Care Challenge may be the better opportunity for you, because for enhancing integrated care, you really have to be started already with an initiative to be able to participate. Questions coming in fast now. The next question, is the lead agency required to have a history of receiving public health funds? Meg, can I turn this one over to you?
So speaking specifically to the challenge, we've had quite a mix in the past with that type of offering, really ranging from all kinds of sectors and all kinds of agencies or organizations. There certainly is no limitation on what that looks like in terms of nonprofit versus large scale acute centers. There are very minimal registration requirements to meet for that. So I would encourage teams to take a look at the terms. I believe it is, off the top of my head, section 4 or 5 related to specific eligibility, but it does not have to be an agency that has a history of receiving public health funds, no.
Thanks, Megan. One of the next questions, lots of questions coming in, but one of the next questions that has come in is a team that'd like to submit their physician wellness initiatives to the challenge, but are unable to access the required metrics. So they're asking, are there alternative metrics that we can provide? I would say, well, Megan, maybe and with respect to the challenge and the quarterly data reporting, I'll again turn this one over to you.
Sure, thanks, Phil. So with the challenge, as I mentioned, it is a flexible offering where teams, once enrolled, have the ability to sort of pick and choose what they want to participate in. The incentive for these metrics and participation in that is the fact that not only do we want this data so that we can appropriately track our progress, but also they're tied to awards. So some of those larger awards, in particular, the last one you'll notice in the terms is tied to, or partly tied to, submitting of these metrics. So we would really encourage teams to have a good look at that within the terms. Section 7 in particular pertains to those metrics. We, of course, here at HEC are available to meet with teams before or after registration to sort of iron out the details around what those metrics look like and how you can appropriately set yourself up to be measuring that. And there is also one option in particular, as I mentioned, related to northern, rural, or remote locations, where If you meet specific requirements, which again are laid out in the terms, you can work together with HEC to sort of define what that metric looks like for you. So there is some option there. So you can participate in the challenge without submitting those requirements. However, making the flag, of course, that not only do we want that to be able to demonstrate our progress across all teams, but also it is tied to awards. So hopefully that provides some clarification. And of course, reach out if we can be of assistance with that.
Excellent. We have a few kind of similar questions coming in from Clara and Sandra related to their initiatives that they're interested in applying or registering into the challenge, and wondering about their eligibility with respect to their ability to show reductions in potentially avoidable ED visits. So do they have to prove that they're reducing hospital admissions specifically?
Apologies, Bill. I was responding to a question in the chat with that you asked that. So I did hear part of your question. I wasn't sure if it was tied specifically to the challenge. You caught me.
It sounds like both of those questions were interested in the challenge, but may also be interested in integrated care. I think something to reach out to us to explore if you have questions about the data reporting requirements, and we can discuss that with you and how you might be able to meet those data reporting requirements. So happy to connect on that for anybody, Clara, Sandra, or others who have questions about the data reporting. Similarly, a question from Denise about how will the data collected quarterly will be used? Will it be collated, and will the results be publicly available? So I can start on that one, Meg. So the data that we receive in the quarterly reporting, it's going to be reported from the teams already in a collated way. So we're looking for total numbers of responses. We don't want to receive individual responses or identifiable information. And we are not going to be publicly publishing that information. We may use sort of top level numbers overall across all teams, but we wouldn't be publishing any of the reported data specifically.
I find, Bill, and we would know this from previous challenges in particular, there always seems to be a lot of question around these data pieces, and we do recognize that it certainly not only has its own sort of learning curve to it, but something that teams often appreciate a little bit of assistance around. So something that helps with that typically is within our coaching and HEC support structures with these programs, which is a really nice thing once enrolled into these offerings. So certainly would encourage teams not only to reach out ahead of time if there are questions or concerns around these measurement pieces, but also once things are rolling to be able to draw on those resources to make sure that you're feeling supported and ready to take the first steps and continue that measurement piece.
There's a question about what a successful application looks like. I will say we've got a bit of a demo video coming up later in the Q&A where we'll show you how to actually work through the application process. I think what a successful application will look like is slightly different between the Right Care Challenge and Enhancing Integrated Care. So for the Right Care Challenge, as Megan was explaining, this is really sort of more of a registration process to enter into the challenge. So there is some minimum information required in that registration. But once you're in, that opens up the opportunities, the various award submission opportunities, and access to coaching and virtual learning supports. For integrated care, there are some minimum requirements that we're looking for in the application. But we're really looking for a broad spectrum of initiatives and teams working on team-based integrated care. So I couldn't say that there is one specific thing that we're looking for that would make for a successful application. I will say for integrated care, as I mentioned earlier, you do need to be underway with an initiative already. And we're looking to support initiatives that are either proven or promising in terms of their ability to improve access to care, to timely care, and potentially reduce avoidable emergency department admissions.
Great, thanks, Bill. So there's another question here related to more specifically time commitment I think is what they're getting at. So they've asked, how have past participants described the time commitment for entry, such as how many total hours to participate? So if we're talking about specifically for the challenge, the entry into the challenge, that is very low effort. If you have all the information before you, such as your executive sponsor and your lead team member, it will likely take you about 5 minutes. And if we're to unpack that a little tiny bit more in terms of what does time commitment look like through a rollout of the challenge, again, that is flexible depending on what the team avails themselves of in terms of the offerings within that program, such as award opportunities or coaching opportunities. But we have heard in the past that typically things sort of ebb and flow and ramp up in preparation for award deadlines, given that teams are pulling together, that submission, and as well around reporting deadlines once that comes around for further data. I'm not sure, Bill, if you want to unpack more specifically for integrated care, what that might look like in terms of time to get registered.
Yeah, so the application process is fairly straightforward. So if you have all the information prepared, it'll probably take you about 15 minutes to complete that application. But having said that, there are part of the application asks, for example, for executive sponsor support. So you are going to want to make sure that your senior leadership or your executive sponsor is on board and supporting you in applying to participate in the program. So that may take some additional time to seek out.
There's another question here, Bill, if I could throw it your way, asking if the project addresses integrated care, but is not led by an integrated care team specifically, would that team be considered as eligible?
Yeah, great question. I think that's probably one where I would encourage that person to reach out to us to explore that further, just so that we fully understand the type of team that they would be coming forward with and whether that would qualify or not. So it's a bit hard to say based on the question, but I really encourage that person to reach out to us, and we can paste our contact email in the chat again for your convenience.
Maybe I'll take this opportunity to piggyback on sort of that question around eligibility for a specific program. There's another one here asking more specifically for the Right Care Challenge. We are an acute care hospital that is looking to participate through reducing avoidable hospital admissions / readmissions. Is this type of initiative eligible? So the short answer to that is yes. Essentially, the challenge is I will say far-reaching or broad-reaching, where we're really looking for interested organizations and teams that have an idea or already implementing something that will see to reduce that burden on emergency departments. So really, the breadth of opportunity there is quite broad. If you have a more specific scenario that you would like to chat with us about or to look at with you prior to enrolling into the challenge, please do reach out and we can chat about that a little bit more.
So there's some other questions from people working in a nonprofit organization not connected to a health region or authority. And question about both eligibility for the Right Care Challenge, but also about the fact that they don't have access to hospitalization data. And so how might that affect their eligibility? So I will say that yes, we'll provide a guidance to teams on different approaches to getting the information that you'll report in your quarterly reporting, such as the patient survey. And the approach around measuring the avoidable emergency department use has been developed in a way that support teams that don't have access to hospitalization data. So that won't be a barrier for your team to participate. And we will have questionnaires for sampling patients or clients in order to meet the data reporting requirements. I think another organization as well is asking about if they're eligible to participate if they're not connected with a health authority as a not-for-profit.
I'm just reading that question again. Bill, as the way you read it is different than what I was reading here, so I'm not computing the two right now. So a home care company that is looking to implement a technology to improve quality of care, do they have to prove that it also reduces hospital admissions specifically? I have to say I'm not fully following this question. Bill, I'm not sure if you have an answer for this one, but I'm happy to take this one offline as well.
Yeah, I think we've touched on this, but just to emphasize that the avoidable hospital admissions or emergency departments, this is sort of an upstream question that we're looking at. So there's no need for hospitalization data. We will be asking teams to do patient surveying or client surveying to get at this data, and we have templates and guidance to do that surveying. So not having hospitalization data or hospital admissions data is not a barrier to participation.
And I think just to unpack that a little bit more, we're speaking more so to the option A, which we spoke about very briefly. And I can say that in terms of more resources to support what that looks like, including the templates, is slated to come and be shared with teams that are already registered to the challenge around May 30th. So that will provide a little bit more information for folks once they're rolled into the challenge.
Another question from somebody asking if if one agency can be part of more than one project applying. So I think I read that to mean if an agency or an organization can be part of multiple teams that are participating in these program offerings.
There's another question here related to specifically for the Right Care Challenge and that registration period. So folks have probably noticed by now, we've referenced this a few times, but registration into the challenge remains open for quite a long time until October 31st. So we sometimes call that rolling enrollment. You can basically come in when it fits you. So the question is, if an organization applies in the fall or registers in the fall, I should say, how does this impact the timelines for reporting, award opportunities, and coaching? So at a very high level, all this will mean is once you register the challenge, whether it's in July, August, September, or closer to the end of October, you're picking up where we are in the challenge. So if there is an award opportunity that has already passed, that opportunity has passed. If we've already gone by a deadline for reporting data, then we are by that deadline for reporting data. So if you missed the first one, you would have 3 remaining opportunities. So there is a little bit of an advantage here, of course, to get in sooner than later. But we want to recognize that everybody or some teams may be starting at different places and at different points. So Historically, through our other challenges that we've led here at HEC, we've had teams come in at various timestamps and seen great success across those various timestamps. So would encourage folks to take the time that they need, and also keep in mind that to take advantage of the opportunities. Getting into that challenge sooner than later also gives you more opportunities. So.
Thanks, Meg. Another question on whether they can, do they need to apply or can they connect with an HEC staff member to determine eligibility? I would say if you have any questions about whether you're eligible, please reach out. We're here to connect with you and discuss that in advance of your application. And we'll be pasting our contact information in the chat and following up from this session with that information so that you have it in your inbox. But yes, please reach out if you have any question about your eligibility to apply or register into the challenge. There's also a few questions about participating in more than one program offering, whether that be the Integrated Care, Right Care Challenge, other programs such as our Sparking Change and Appropriate Use of Antipsychotics. So overall, I would say yes, you are able to participate in multiple program offerings and take advantage of those. We do have some specifics related to the ability to participate in multiple programs in our FAQ, so guidance around the data that you submit and some nuances in terms of that data and the data being from different initiatives. So encourage you to look at the frequently asked questions document for the specifics around that, but yes, you can apply and participate in multiple program offerings from HEC.
Great, thanks, Bill. I'm going to toss a question your way here, given your role in working up the coaching pieces of these offerings. So the question is asking more specifically, are the coaches similar to extra coaches? And for folks on the line that may not be familiar with our extra program, that is a very long-standing program here at HEC, focused on executive training, executive leader training that we've had for several years here at HEC. So Bill, did you want to speak to the coaching piece a little bit more?
Sure, yeah. So I would say yes and no. So there are actually overlap in the coaches that are supporting extra and that would be supporting teams that are participating in these two program offerings. However, the coaching support and the nature of those two programs, these programs are quite different than extra. So extra is quite an intense improvement program where teams participate over the course of several months and have a lot of interactions both with the HEC staff and their coaching. It's sort of a high level of commitment. These programs are structured to be quite a bit more flexible and light touch overall compared to the extra program, and involve many more teams than the extra program would engage. So the coaching support is a little bit lighter with those bi-monthly group coaching sessions and on-demand one-on-one coaching support.
Great. Another question here, which I may want your help unpacking a little bit, Bill. So speaking to agencies that have shared services. So wondering if they can work on one project to bridge gaps or challenges that have positive impacts, such as mental health or emergency preparedness. The example they've offered is public health community services versus community social services. Did you want to pick up on integrated care first, or you want me to make a run at the Right Care Challenge?
Yeah, just reading through that question. I think yes, for both integrated care and the Right Care Challenge. I'd be interested to connect with that person to explore that a little bit further, but I think both opportunities and certainly the Right Care Challenge would be an interesting offering for them.
Yes, would agree with that. One thing related but unrelated might pertain to multiple organizations or agencies banding together to sort of register. So happy to take this more offline for where this may apply for some teams. But registration is set up for sort of one team to register. So would want to just think through if I'm a registering team, what that looks like in terms of any potential awards that that you may win. And how that's sort of dispersed amongst any partnering sort of organizations and what that looks like. So I'll just put that offer out there for anybody that might sound like something you're scoping or thinking about, so that we can have that discussion offline.
Yeah, and just to emphasize again, as long as you would have the ability to report on the data measures, so having access to sampling your clients or patients in order to report on the data reporting requirements. In terms of eligibility of teams participating from Quebec, to my knowledge, there are no restrictions in terms of any province or territories participation. So we hope to have teams participating from all provinces and territories, ideally.
That's great. We just sort of unpacked this a little bit, but I'm going to go a step further for this question. They're asking, can one agency apply with more than one team, i.e. different programs doing different things? So what I want to say in reference to the Right Challenge for this one in particular is yes, absolutely. You can have different, say, sections of a hospital applying and joining into the challenge, so long as team members are different and the data that they're using is also different. So different projects within that setting, for example. We've absolutely seen that in the past. If you have any questions around what that could look like, or you want to unpack that a little bit more, absolutely, please feel free to reach out on that.
And just to highlight and flag for folks that we've just pasted, Colleen has just pasted in the chat the frequently asked questions that has been developed to support applications in the call for application in relation to the measurement. So that's a great resource to refer to as well.
We might be coming up to some of our last questions here, Bill. I think we did unpack this a little bit earlier, but we can pick it up again around the estimated commitment of overall time for participants. I'll slot that over to you and specifically for integrated care.
Yeah, I think just to say again, we've designed the programming to be quite flexible in terms of the coaching, support, and virtual learning and networking opportunities. So those are optional but encouraged supports that are available to teams that are successful in participating in integrated care. Similarly, with the Right Care Challenge, those are optional, flexible supports that you can take advantage of. The time commitments, I think you will have to devote some time to doing the quarterly data reporting and collecting that data. That's going to be some time each month devoted to doing that patient surveying or gathering that data required as part of the quarterly data reporting. Hard to put a specific time amount on that, but I really do want to emphasize that these are designed to be quite flexible so that you can take advantage of the various supports available to you if helpful and as needed along your journey.
That's great. Thanks, Bill. So I'm not seeing any more questions coming in, but please, if others come to mind, do share them. And certainly thank you to everyone who's shared their questions today. So we've added in a link to the FAQ document into the chat So hopefully we can address any additional questions that may come up in the interim. And I'm sure you're wondering now, how do you apply? So to help you get started, we're going to share a quick 5-minute demo video that shows how to access the portal and complete the registration process. It'll also help you know how to navigate your application and more depending on the programming that you're looking at. So just gonna make a quick ask for that screen share.
Welcome to HEC's Community Portal, a secure space where you can apply to and manage your participation in HEC offerings. Let's get started by setting up your account. This will ensure you stay up to date on the latest offerings. As a first step, select Get Started and then Sign Up Now. You'll be prompted to enter and verify your email address. Once you receive the verification code via email, enter the code into the form to complete your registration. From there, you can complete your user profile and you're ready to go. From the home page of the Community Portal, you can explore HEC's current offerings and learning opportunities. To apply or register for an offering, select Enter Here to access HEC's program management platform directly from the portal. Here, you can view and submit applications for active HEC offerings, invite others to collaborate on your application, and manage reporting, including progress and financial reports. On the home page, you'll find a list of active HEC offerings, key program details, important dates, and eligibility requirements. You'll also find helpful guidance on how to navigate the platform and access the information needed. To get started, click on Apply Now in the left-hand menu. From the Apply Now page, click on the Application button for the offering you're interested in. Then complete the appropriate application to register or apply to participate. It's important to remember that the portal does not auto-save. Be sure to regularly click Save or Save and Close at the bottom right corner to avoid losing your work. You can save your application and return to it later, as long as it is submitted before the application deadline. To support the completion of your application, you can invite a team member to collaborate. When completing the team member information, check the box labeled Invite Team Member to Collaborate on this submission. They'll receive an email notification and be granted access to work with you on the application. The email will include a link for your team member to create a user profile in the HEC Community Portal to access the application in the Program Management platform. When your application is complete and you're ready to submit, the Submit button will appear, but only after you've saved and closed the form. Keep in mind, once submitted, you'll no longer be able to make changes to your application. To view all applications you're collaborating on, select All from the drop-down menu at the top left of the screen. After all required information has been submitted, the team lead will receive an email notifying them that their application has been submitted. If HEC staff need more information about your application, the team lead will receive an email outlining what's required. You'll be invited to log in to the program management platform to make edits or provide the additional details requested. The team lead will be notified of the outcome of their application via email after the review process. If your application is successful, you'll be enrolled in the offering. Each offering comes with an established reporting schedule for all participating organizations. To submit a report, go to the Report section in the left-hand menu, then click on Due. Here, you can view your upcoming reports and submit the required data. You can also view previously submitted reports under the Submitted section. If you're enrolled in the Challenge offering, you may be eligible to apply for awards. To apply, go to the Admitted or Awarded section, select your active enrollment, and look for the available award option. If an award is currently open, Click the Submit button to complete and send in your award application. Once submitted, the team lead will be notified of the outcome and any next steps following HEC's review. Now that we've walked through the HEC Community Portal and the Program Management Platform, here are a few key reminders to keep in mind. It's important to remember that the portal does not autosave. Be sure to regularly click Save or Save and Close at the bottom right corner to avoid losing your work. You can save your application at any time and return to it later, as long as it's submitted before the application deadline. When your application is complete and you're ready to submit, the Submit button will appear, but only after you've saved and closed the form. Keep in mind, once submitted, you'll no longer be able to make changes to your application. To view all applications you're collaborating on, select All from the drop-down menu at the top left of the screen. If at any time you need help with the application process, be sure to check out our frequently asked questions and call for applications documents. These resources include valuable details like eligibility requirements, important dates, and guidance to support a successful application.
Huge thanks to our colleagues, including Meg Taylor, who put that demo video together. So we're starting to wind up today's session. We have included a few helpful links in the chat, including the application portal and web pages for each of the offerings, as well as our contact email address. And again, all of this information is going to be provided to you in the recap email that will be sent to all registrants to today's webinar, along with the recording of the session and the demo video. If you have any questions or comments, please reach out to us at the email address posted in the chat. It's application-demand@hec-esc.ca. Thank you to all of you who joined us today. We hope you found it informative and will join us in this pan-Canadian movement to improve health outcomes, care experiences for patients and providers, and help improve the value and equity and quality of care. I'd also like to thank our colleagues behind the scenes who ensured everything ran smoothly today, including Alessia Forchilli, Carol Rondeau, and Sheena Sherwood, as well as our interpreter, Karian Rosbach. That's it for today's event. Hope everyone has a great day. And again, please reach out with any questions. Thanks, everyone.